Here's two guys that survived a Wheel of Fortune telethon, Aaron and Jonathan.
Howdy, and welcome to episode 34 of In the Rabbit Hole's Urban Survival Podcast. In today's episode, Ron Davis shares with us some sexy CPR. We're your hosts, Aaron
and Jonathan.
You are in the rabbit hole, safe and sound. Back by popular demand, Ron Davis from EMS Newbie podcast is here with us again today. And today we're going to talk about first aid, first response, and all kinds of fun medical stuff. So, Ron, where do we begin? If we're the first person showing up and someone is incapacitated or ill or any number of medical stuff.
Well, I mean, obviously it depends. You do different things for different issues. One thing is that people talk a lot in heart attacks that, you want to have someone there within 4 minutes because that's how long the nerve cells in your brain work, It can go without oxygen is about 4 minutes. And after that, you start having brain damage. Well, and everybody's always big on EMS having a response time that's under 4 minutes. But the fact is, what you need to do is get CPR going in those 4 minutes. So you're probably not going to get an ambulance to your house in 4 minutes. You might, because they're like right across the street. But most people are not going to get an ambulance to their house in 4 minutes. But you'll survive if someone starts CPR. So that's a situation where if you have someone who falls down dead and they don't have a pulse, call 911, start CPR, start chest compressions. That's all you got to do. Start chest compressions. And I found a great video for it. I was teaching this the other night, and it's this Staying Alive CPR video that National Heart put out. And it has this comedian guy. He's in the TV show Community, and I cannot remember his name. I really need to learn his name. He's Asian, and he's done a number of comedic roles. But it turns out he's a doctor. He's actually a doctor of internal medicine who went and became a comedian and an actor. And he's doing this thing, and it's got this whole disco theme to it. And there's someone playing Scrabble, and the guy who's playing charades. A bunch of people, and the guy who's doing the charade falls down, and they're like guessing, heart attack, the sequel, it's a movie. And then they realize he's having a heart attack, and they're all standing there staring at him. And the song Staying Alive starts playing, and these two girls that look like GoDaddy girls, blonde hair, white T-shirts with words on them, come running in. And one's T-shirt says, call 911, and the other one says, start chest compressions. And that's it. That's all you got to do these days. But it's important that you do it and not wait for the GoDaddy girls to show up, because reality, they don't just show up.
I was going to purposefully try to give myself a heart attack.
Yeah. And
I think you tried that last week. It didn't work.
Yeah, it didn't work.
But so, Ron, CPR got a lot easier.
Yes.
So, could you give us some idea of what happened? I mean, all of a sudden, it's not this whole push 3 times or 5 times and then breathe. It's now all about the pushing, right?
Right. Well, there were a number of reasons that they made these changes to what CPR is, to basic. That's what they call bystander CPR, which is the CPR that, they want people to do on scene. Well, there were 2 big things. Is the evidence shows that chest compressions are more important than breathing in adults.
All right, sorry about that. I had to stop the show for just a second. We forgot the AC on, so if there is a loud AC noise in the show for the first few minutes, please excuse. But anyway, back to what we were saying.
Yeah, we were talking about how they've changed CPR and bystander CPR specifically. And one of the reasons is they found that chest compressions were way more important than breathing in adults. It's a little different in pediatrics because most babies have a heart attack because they stopped breathing. So getting that airway open is important with babies. But with adults, if you think about it, if you fall down dead right now, your blood's oxygenated, because you were breathing just a minute ago and you were oxygenating that blood, and now you're dead. And the blood's just sitting there, but it has oxygen in it. So if you can get it moving around, then it will do its job of oxygenating your cells. And so we found that compressions are the most important part. And they actually changed all the different levels of CPR. And the one we were talking about is bystander. But even if you go up to like healthcare provider or advanced, which is the breathing, so that's 2 breaths, 30 compressions. Even if you do that, it's 30 compressions, 2 breaths. If you walk up on someone who's down, you do chest compressions first. You do a round of chest compressions before you even start breathing for them. And that is because they found that the outcomes are better with chest compressions. The other reason they changed the bystander one and took the breathing out is because people were reluctant to breathe for other people. I don't want to put my mouth on that guy.
See that.
You know, I don't even know who that guy is. I'm not going to put my mouth on him. And which makes complete sense and is totally logical. And so they just took it out so that people would do something. You know, they would call 911, get help on the way, and start doing chest compressions. And,
Makes sense.
And so, yeah, it's just very simple. It's so simple now that I've just explained it to you, and there's not a reason any one of you could do this. The 2 other things you'd want to know is where to do the chest compressions. And there's a video, which I'm assured will be in the show notes. Actually, I think it's been on your blog before.
I don't know if we had or had. We'll put another link to it today.
But if we didn't,
Yeah, it's called Sexy CPR.
And it was put out by a lingerie company.
I believe so, in the UK.
Yes.
And the funny thing about it, and I was talking about this with some other people, is this shows what a geek I am, an EMS geek. When I first saw that, I had just taken CPR. And in case, just a little description, these 2 lingerie-clad women, one of them is giving the other one CPR, doing CPR, and they're explaining the steps as they do it. And I remember watching it and going, this is really CPR. Now, if this is 2 hot chicks, like, doing hot chick stuff, I was really, like, amazed that was really CPR. And that's the advanced CPR, the one they do. They're going to talk about breathing and head tilt chin lift. Remember that because it is the best example of head tilt chin lift, and we're going to talk about that in a minute as well, that I've seen video-wise, but it is really CPR. It's just not the new standards for bystander CPR, which would have been a whole lot less interesting.
That would have been a lot less sexy.
Yeah. But one of the things is they tell you where to do the compressions.
Yes.
And they say, you need to be in the middle of their chest between the nipples, which the joke is, yes, on that model, you can go between the nipples. And on most guys, you can go between the nipples. But, you know, gravity is not a woman's friend, and the nipples are not always in the medial line any longer. And so you need to go where the nipples should be on their chest. And
where they were when they were youthful.
Yes. Or where they would be on a guy. Yeah. You know, that line is where you want to be. And you want to push in 2 inches for every compression. And the beat is 100 beats per minute. So it's 100 compressions per minute, which is the beat to the song Stayin' Alive, which is why that video has Stayin' Alive. And the video runs a little long, the AHA one. And I was like, why are they running this so long? There's like a little dance thing at the end where they're all doing disco dancing and listening to Stayin' Alive. And I figured it out. It's because they want that song stuck in your head.
That song does have a tendency to get stuck in your head. Now, I've heard you should not actually sing Staying Alive out loud.
You can sing Staying Alive. There is another song that is 100 beats per minute that you shouldn't sing out loud, which is Another One Bites the Dust.
Oh, that's the one.
Do that.
Yeah, okay.
So when doing chest compressions on a dead person, do not sing Another One Bites the Dust.
Although, should you really be doing chest compressions on a dead person?
Well, you should only be doing chest compressions on a dead person. If they're alive and they tell you to stop, that's an indication you didn't need to be doing chest compressions.
At that point, you're simply using it as an excuse.
Yes. Yeah, I think one of your listeners sent a question about CPR, and yes, it is inappropriate to do chest compressions just because the chick is hot, okay?
Especially if she's asking you to stop.
Yes. No means no.
Yeah, it was funny. One of my teachers told a story about a call they got, and they showed up at this teenage girl's slumber party because one of the girls was complaining of chest pain. And they get there, and she's oriented and talking to him, and they're all talking to him, and they're like, well, what caused your chest to hurt? Oh, it just started hurting. And she's like, she could tell something. They're not telling her something, you know. And so she I think she got some of them to the side. She's like, okay, come on, you can tell me what's the deal. It's like, well, Bambi, she fell down, and we thought she was having a heart attack. So we started chest compressions on her. And the reason her chest hurt is because I guess, were doing them right. And that can separate the cartilage. It will separate the cartilage from your ribs from your sternum. You'll feel like a snap, crackle, pop kind of feeling, like you pressed on bubble wrap for their chest if you're doing it right. It's not breaking their ribs. Breaking people's ribs is not unusual for CPR, but that's not what that is. That's actually the ribs being broken loose from the cartilage that holds them to your sternum. And so that's probably what had happened to Bambi. I don't know if that was really her name, but that's just a Bambi kind of thing to have happen. And so so she was having chest pain because they'd hurt her chest. But so anyway, CPR, just get on that chest and push hard and fast, and that's the most important thing. Call 911 and do that. Because you're the person there. Mm-hmm. You know, you're the person who needs to be acting, and that's the thing that's going to make the difference, is somebody acting right then. So the number one thing you need to do is do CPR for like heart attacks. That's the first thing I could think of where you might be in a situation where you need to do something right now. Mm-hmm. Another instance where you need to be doing something right now is if they're choking on something. Mm-hmm. So if you get something stuck in their if someone gets something stuck in their throat, you need to do what used to be called the Heimlich maneuver and is now called abdominal thrusts. And that's because people have contended that Heimlich didn't, in fact, invent the Heimlich maneuver. They were like other people did too, so they don't want to call it by his name.
Okay.
But Heimlich did a number of things. It turns out he invented the chest tube, which they use on soldiers that decompresses their chest. And someone else told me another thing he had invented. So he deserves any props he gets. Yeah, Dr. Heimlich. But we can put another video, the sexy abdominal thrust video. The only thing I'll say about that video is really your pelvis does not need to be that involved as the guy is on that video.
But it's still another very good example.
Yes, but it does tell you where to put your hands between the navel and the bottom of the sternum and how to do the kind of J curve, which is kind of pushing back and up. Because what you're trying to do is kind of compress their guts up into their diaphragm and push out that. Because you always have air in your lungs, and if your airway is blocked completely, then no air is getting out. But that if you put more pressure on your lungs, then the air hopefully will spit it out. And you continue to do that until the thing comes out of their throat or they pass out. And if they pass out, you start CPR. But that's if their airway is completely blocked and by choking on something. If they're talking to you, not completely blocked. If they're coughing, not completely blocked either, because air's moving in and out. So those two, but if those two things aren't happening and they're like holding their throat, there's a universal sign for choking where you put like both hands up to your throat, which actually is the beginning of that video, so you can see what that universal sign is, so you'll know exactly what to do. But I think most people can make themselves understood that. Yes. I can't breathe, and point to their throat, and you can figure it out, and you need to clear that. Another thing is if someone is unconscious and, like, say, laying on the floor and they don't appear to be breathing, then you need to open that airway. And the first way to do that is with what they call the head tilt chin lift procedure, which is at the beginning of the sexy CPR video. And actually one of the best renditions, videos I could find showing that particular thing. But you're tilting their head back by pushing kind of up on their chin. And that, kind of puts their nose up back a little, straightens out their throat, and that will open up their airway. The most common thing that blocks your airway is your tongue. And so doing that will clear your airway if it's your tongue blocking.
But can you choke on your tongue?
Well, and you're not really choking in that, it's blocking your airway. So in a way you are choking. You're not letting air in and out. What's happening there, though, is it's not like you swallowed your tongue.
Right.
You can't swallow your tongue.
That's the old wives' tale, right? That you could swallow your tongue during a seizure or something like that.
Yeah, and as we said on the Myths, don't stick things in people's mouths when they're having a seizure. Matter of fact, all you really want to do is head tilt chin lift and kind of keep that airway open. A lot of times when people are having a seizure, they're not particularly breathing anyway, and all you're really doing is keeping that airway, trying to keep the airway open so when the seizure's over, then they can start breathing. And when it's over, they're going to be like post-tictal, which is kind of zombied out. They're going to be all loose because all their muscles have been clenching in the seizure. And that's another point where it is very, if they're laying on their back, their tongue kind of will slide back. It's not. You'd have to. I don't have. It's an audio. It's hard to describe. But there's not it's not sliding down their throat. It's that the part of your tongue that goes down your throat is now gravity's pushing it back toward the back of your throat. So it's blocking your throat. So if you tilt your head, it'll open that up and kind of stretch your tongue out, and so that won't happen. So head tilt chin lift is what you do if you find if someone's unconscious, and just to make sure that they got air coming in and out. Another thing they took out of CPR was look, listen, and feel, which was a way to check whether or not they were breathing. They took it out because a lot of people can't tell anyway. Even if you do stick your ear down there next to their mouth and listen, you may or may not hear it. If their chest is going up and down, if you're looking at their chest and they're getting chest rise and fall, then they're breathing. They may not be breathing adequately, but they are in fact breathing. So to clear the airway, you do that. If they're vomiting, which is another reason that people didn't want to do CPRs, because a lot of times people have a heart attack and they vomit, and you don't want to have your mouth on them when that happens.
Yeah, I know.
Yeah, so
we've all met that girl at the party and said, no, I'm not. Wait, completely different show. Sorry. Anyway,
yeah, that's a completely different reason to put your mouth on her.
Stop reminding us of those situations.
Yeah. Actually, if someone does vomit and you're afraid of that, just kind of roll them on their side and open their mouth and let it flow out. That's clearing their airway. We use suction. That's what we would do. You don't have suction. There's the things they tell us not to do. We talked about BSI, and if it's wet and it's sticky and it's not yours, don't touch it in the other episode. There's things we do that we don't do, like we don't put our mouth on someone else's mouth. We use an instrument to do that. We suction. We don't go in there and try and sweep things out. If you've got something stuck in your throat and you can't clear it with the Heimlich, we have a tool, McGill's, that we can kind of stick down your throat, and it's like a pair of not pliers, looks like salad tongs.
It's
really,
grabby thing of some sort.
And you kind of stick it down there and you can pull things out if you can see it. But if it's a loved one, you might stick your finger in there and try and pull something out if you could see it.
As long as it's not a seizure we're talking
about.
Right,
yeah. And that's the thing. The reason we don't want to stick our fingers in people's mouths is because they could clench their jaws with your fingers in there, and then you have a different emergency, and it's yours, and that's bad. Don't, in general, you're not going to go trying to clear out people's airway that way. Just turn them on their side, and if they're puking, they'll puke something out, and it should clear things up. And you've called 911 if you think they're not able to breathe and they're puking, and someone will be there to clear their throat out, and it doesn't have to be you. So those are two instances where if you're the first one on scene, you need to do something. The third one I had that I was talking about was stopping bleeding. So, the zombie apocalypse has come, and you were out with your complete black tactical outfit, and your buddy was out there with you, and a zombie shot you.
Those zombies.
Yeah. Actually, if the zombies start shooting back,
then we have real problems.
We are really up the creek. Because fighting dead people who can shoot, that's bad.
That is bad. That's actually quite terrifying than just zombies on their own.
And wasn't that like the third or the fourth or whatever zombie Dawn of the Dead movie was? One of them got smart and figured out how to use a gun.
I actually never saw any of the Dawn of, but
what?
That I know. I never saw it.
But yes, Ron, that's exactly what happened.
But now I am going to have to go watch it just to see.
I actually haven't
want to
seen
see
that
the zombies get smart.
Yeah.
But if you get shot, in the leg, and there's blood coming out of his leg, first thing you do, apply direct pressure. And that's kind of a natural thing that you're going to do. If you're ever in the kitchen with your knife and you slice the end of your finger, the first thing you do is go, ow, and you either stick it in your mouth, not a good plan, or you grab it with your other hand, right? And
so now
why
is sticking it in your mouth a bad plan?
Because your mouth is full of nasty crap and you don't want to put it in an open wound. Actually, another reason might be, depending on how bad you're bleeding, is that blood is an irritant to your gastrointestinal tract and will make you puke. So that's a bad thing.
Interesting.
So don't drink blood.
So after pressure, we go to...
Well, if applying pressure either directly with your hand, although, if it's wet and it's sticky, don't touch it. Yeah. So wear gloves. But generally, if it's you, you're going to do that. You're just going to naturally grab it with the other hand. If it's somebody else, you can grab a bandage and apply pressure. And so you apply pressure, and you need to apply that pressure till the bleeding stops. Now, that can be a while. I mean, to actually get full bleeding stoppage can take 15 minutes. But if you put it on there for a couple of minutes and you still got blood running out of the bandage, it soaks through your bandage, it's coming out, then you need to apply a tourniquet if it's an extremity, if it's an arm or a leg. If it's a head wound, you do not apply a tourniquet to their neck. That's a bad
Unless
thing.
you just really didn't like that person.
Yeah, well, in that case, you can just sit there and watch them bleed to death. That's just as good.
So now, what about the different clotting aids? Because we have the Israeli battle dressings now,
Right.
and Quick Clot and all that stuff.
Quick Clot, and I actually got that question on Wednesday night about whether you should use it. And they do work, and actually we carry them on the ambulance, and I asked the in-charge when we would ever use the Quick Clot, and he said never. Because the problem with it is that for most trauma, the solution to the problem is surgery. And if you poured Quick Clot in it, it causes them problems. They I don't know if they have to clean it out or if it's just causing too much clotting or what. But so they don't like you come into the trauma center with it. So I asked our medical director, well, then why are we carrying it? And it's for non-extremities, uncontrolled bleeding. So if you have a head wound and we can't control the bleeding with pressure, then we would go to something like Quick Clot. But we would use a tourniquet on an extremity wound before we would use Quick Clot.
Really?
Yes, because Quick Clot has other problems. When you come into the ER, they don't want you to have that. So
Now that I'm assuming that may change if we're talking about a wilderness situation, which we're not.
We're not talking about a wilderness situation. But the fact is, I mean, I don't remember how much we talked about tourniquets, but you can have a tourniquet on for a long time, like hours on an extremity without the fear of losing that limb. In Iraq, they did a study at the Baghdad Combat Hospital, and they treated like 400 or 800, either one of those two, soldiers who had a tourniquet applied up to 4 hours, some longer, and nobody lost a limb because of the tourniquet.
Wow. That's counterintuitive based on what you've been hearing these days.
Yeah, well, the thing is, everything we learned about tourniquets before Iraq was we learned in the Civil War.
That's a long time to go without reevaluating something.
And what happened was in the Civil War they used tourniquets, but this is the way medicine went in the Civil War. So you have a big battle. There's a bunch of guys out on the battlefield now after the battle, laying around moaning, bleeding, dying out on the field, and basically they didn't do anything. So they laid out there for like hours. Some people said they could lay out there for like 24 hours, and then they would go out to the battlefield and they would start looking at people and they'd be like, "Oh, look, that dude's he's bleeding, his leg's bleeding pretty bad. Let's put a tourniquet on it." So they put a tourniquet on the guy's leg, and then they leave him laying out there in the battlefield, and they come back like the next day, and assuming the guy's still alive, his leg's all swollen up and nasty, and they're like, "Man, look what the tourniquet did." No, the tourniquet didn't do it. It was laying out in a field for 48 hours with an open wound that made it all nasty. And so they're like, well, tourniquets are bad. And so tourniquets were bad for years and years. Probably through the Vietnam War, they were considered bad. And then people started doing actual research on it and found that, I talked about your nerves, the nerve cells. Now, what I really meant was your brain needs oxygen within like 4 minutes. If it's not getting new oxygen within 4 minutes, you're going to start having brain death. But muscle goes a lot longer than that. It can go up to 4 hours, 6 hours, sometimes even 8 hours, depending on what's involved, what the use of the muscle is. So, like, you don't have an oxygen demand if you're laying on the ground. Well, if you're like in coronary arrest, well, your thigh muscles aren't going to burn any oxygen because they're not doing anything. And so what they found was since they didn't have a high oxygen demand, they could go a long time without getting new oxygen. And so they started using tourniquets. And tourniquets, they save people's lives because they don't bleed to death, which is the problem. So every soldier in the U.S. Army carries a tourniquet. They carry the CAT tourniquet. And as a matter of fact, most medics carry more than one. And that's because they carry it for two reasons. One is they found that on muscular soldiers, with big thigh muscles. They found one wasn't enough to actually stop the bleeding. So when you put on a tourniquet, you apply it, you tighten it up, you crank the windlass on the thing until bleeding stops. Well, if you crank it as far as you can and bleeding stop, what they would do is just go up above that one and put another one on.
Okay.
And crank it down till the bleeding stopped. And so that's how, you're just cranking till the bleeding stops with a tourniquet. And the other reason is because you can have two wounds.
Mm-hmm.
And I know I had seen a picture before, and I may have even sent it to you, of a guy who had been at the range.
Yeah.
And something happened down the range, and it shot down the range, went through one leg and then through the other leg. And someone had a tourniquet, but they only had one. And so if you see the picture, the guy's sitting in a chair, he's got oxygen on, and one leg has a tourniquet applied, and the other one has a belt wrapped around it. And that was because they only had one tourniquet. So 2 is 1, 1 is none.
Yes.
You guys
And
about
you
that
have
before.
a particular pet peeve about the tactical.
Yes.
Tactical has invaded even medical supplies.
Yeah, and I actually talked to the guy. I bought my tourniquet from a particular company, my Tourniquets, and they make this thing called the Individual Officer's Kit, and it's like this vacuum-packed kit, and it's a great thing. I own like 3 of them. They're like in each of my wife's car and my car and another car. But what's in them is a pair of gloves, black gloves. Like you had to like special order that crap to get it in black gloves. A tourniquet, black. A bandage and a dressing. For those of you who don't know the difference between a bandage and a dressing, this is kind of that Clip magazine argument. But a bandage is what you put on the wound, and a dressing is what you use to hold it in place. So there you go. And so it has a bandage and a dressing, and you can get a version of that has a quick clot dressing, or a quick clot bandage, not a dressing. And so it has the dressing, the tourniquet, the gloves. Yeah, that's all that's in it. It's those 3 things. And when I ordered it, I go, can I get they sell a fluorescent orange tourniquet and a blue one, but I was like, can I get the fluorescent orange one in the individual officer? Because they're like, no, we don't make them that way. That's our police one, and they're all tactical black. But yeah, I hate tactical black for a number of reasons. Like half the crap that you need in a preparedness situation, you don't want to drop in the dark and not be able to find. That includes your gun, your tourniquet, anything that's black.
So, Ron, are you in favor of neon guns? Is that...
When I went and bought my carry gun, which is a Springfield XD, I searched around trying to find the one that has the silver slide.
Oh, yeah.
And the black handle. They have an olive drab one, but once again, you're like olive and tan. Those are camouflage. Yeah. Well, while the tan would probably work in a situation where you dropped it on the ground, it's still not made to be seen.
Right.
The silver, of course, reflects light, so you can see it. And I actually found it. I bought it. I had a special order in my XD to get the silver slide.
Oh, did you really?
Yep.
Yeah, and plus, I think it just looks better. I think it's a pretty gun when you have a silver slide on it. The XD's not that pretty.
It adds a little something extra different.
Yeah, and so, the tourniquets, I got the bright orange one, and this is the reason I got the bright orange one. So, say you have to apply a tourniquet to a guy who was in like a motor vehicle accident. Well, he has what we call multi-system trauma. I mean, he's going to have other problems, like maybe his head. He has a head wound which is bleeding all over the place because head wounds bleed all over the place. And he has a broken arm, and it turns out he has a broken femoral artery, and so you had to apply a tourniquet to his leg. Well, they're going to work on the thing, they're going to work on the thing they see the first, and then they're trying to work on the things that are the most important first. Well, I don't want to have to tell them, look, there's a tourniquet on his leg, because they're not going to notice the black tourniquet. I'd rather have a bright orange tourniquet around his thigh, and I don't even have to tell them there's a tourniquet because they can see it. So that's a reason I don't like the tactical black tourniquets. But
makes a lot of sense.
Yeah, but that's the way they make them, in black. And I talked to the guy at EMS World last week from that company, and I was kind of like, do you make the other? And he's like, well, no, we don't, but of course we can do anything you want. And now actually they allow you to create your own kit. This company does, and he said you can put anything you want in it when you do the create your own kit thing.
So when are you going to come out with the EMS Newbie podcast kit?
Well, I don't know.
You'll have to let us know.
I will.
We'll put a link.
And I may do something on preparedness first aid, and I was thinking, that was actually what I was talking to the guy about, was if I did a preparedness first aid kind of thing, maybe we could have a kit to go with it. And he's like, yeah, sure, you can make your kit like anything you want. And so I think your tourniquets should be bright orange or some bright neon color.
That kind of makes more sense to me than using tactical black.
Yeah. And they made the thing for tactical units. It's made to be stuck in a pocket in the, combat pants, whatever you want to call them. Yeah, EMS pants have lots of pockets, but it's made for the soldier pockets and the thigh pocket. And it's about that size to go in there. So they made it for like SWAT teams. SWAT teams may actually have a reason for their stuff to be black. Maybe. I'm not sure I'm buying that either. But that's another discussion about, whether you want to go through a house in black.
Yeah.
Yes, you do. But when you get shot, you're going to wish you were wearing something people could find you.
Yeah.
Right.
So tourniquets are bleeding control. And if you get that individual kit, and we'll put a link to it, if you get the individual kit, it has a bandage, so you can do the apply pressure first. Has gloves, so even if they are tactical black, they has gloves so that you don't have to touch something that's wet and sticky and not yours. And it has a tourniquet if the bandage doesn't work. Those things. And they have quick clot tourniquets, but quick clot bandages. But like I said, if you're not going to be in a wilderness setting, or if it's not the end of the world as we know it, you probably don't want to use the quick clot on something you could stop the bleeding with a tourniquet.
And I think that is a significant distinction between the two of what we're talking about. We're talking about normal, everyday, practical stuff where there are still systems of support in place. Because I think there's an issue that happens, a toxicity issue that happens when you remove.
Yes,
that needs the tourniquet.
That's kind of another
happen.
Myth that you should loosen the tourniquet every so often. Don't do that. All you're doing is making them bleed again. It's not. I don't know the logic behind it. I guess the idea was that you're letting some blood into the limb, and so it's being able to oxygenate. Well, the problem is once you apply a tourniquet and blood is not returning to the body, it starts to get acidic. And acidic is bad. You don't want a bunch of acidic blood. If your blood gets acidic, that's bad. But since it's not flowing back into your body with a tourniquet on, it's okay. Leave it that way. As a matter of fact, don't take the tourniquet off, period, because some special things need to be done when the tourniquet is taken off to compensate for that acidic blood coming back into your system. Because if you just pop that turkey off and all the blood that was in their thigh is now suddenly pumped up into their heart, you'll have a heart attack.
Wow.
It'll stop your heart.
There's the other piece of that too, right? So everybody's worried about the loss of the limb. The reason you've used a tourniquet is to save the life. Then you have to kind of say, all right, even if you had to weigh that, would I rather be alive or be missing the limb?
Yeah, right. I think that goes back to when we were talking about 7 Habits priorities.
Yeah. Right.
Yeah, and in EMS we talk about what will kill you the slowest.
Right.
Bleeding to death will kill you faster than just about everything else. So stopping the bleeding is the most important thing. But I think when we're in an EMS setting and we come up on somebody and they have that kind of bleeding and we say, okay, we're going to apply a tourniquet, they freak out. Because they're like, oh my God, I'm going to lose my leg.
Yeah, because we were all told.
Because everybody thinks that, And so taking a second, while you're putting the thing on, say, look, you're not going to lose the leg. That doesn't happen for hours. There's new studies. It's all safe. Just kind of comforting them. And the same is true in the situation if you've listened to this and you've gone out and bought a tourniquet and you're at the range next day and the Yahoo next to you has poor control and shoots somebody else in the leg, and you whip out your tourniquet and start putting it on, you may have someone start freaking out and go, look, the EMS Newbie told me it's going to be fine. Those guys on that Rabbit Hole podcast said you won't lose the leg. All this is for entertainment purposes only.
Exactly.
No, I will stand by that. That's standard of care. Tourniquets are standard of care. So.
And that makes sense. So, Ron, the tourniquet's something you keep with you. What are some other things you could recommend that people have with them as far as medical devices or items or
that's
those kinds of things?
Hard question to ask. That's like someone saying, what should be in your bug out bag?
Yeah.
Well, it kind of depends on what you expect to happen when you have to bug out. But if we go to just what we were talking about today, if you have to do, what are the things that I'm going to have to do right now? What supplies do I need to go with that? That's kind of the way I think about it. So my first aid kit has gloves in it. Has lots of gloves in it, actually, because I keep accumulating them. And it has a tourniquet in it to stop bleeding. I actually don't have a mask, a mouth-to-mask mask, which is you can buy them Well, maybe I do have one. I don't know. But they're a little thing that they go over your nose and your mouth.
Yeah, and they have a little
and they have like
picture
a one-way valve on them. And then you blow into the thing, and the one-way valve keeps anything that's from them coming back at you, and it allows you to breathe for people. That might be a good thing if you go and take a CPR course and learn how to breathe for people. But so I have gloves, and I have a tourniquet for bleeding control. You don't need anything for CPR if you're not doing that. The Heimlich, once again, you don't need anything.
Yeah.
I carry Band-Aids because I've had to go pull Band-Aids out way more often than I've had to pull out my tourniquet.
Yeah.
Because most of the time people cut themselves.
Well, I think that goes along with the general philosophy we have, which is, be prepared for the things you're going to run into regularly.
Yeah. Yeah, and I have Neosporin, and I have they have like a little travel version of the Neosporin.
Yeah.
And that's what I carry. I also have some other things in my kit that other people might not carry, but probably wouldn't be a bad idea. I have an eye flush. You can go to your to a store, and they have these little eye flush kits. And basically, it's a bottle of saline solution, just like you get for contacts. And then it has a little cup, and you take and fill the cup up and then put the cup over their eye, or you can just not spray, squeeze the bottle into their eye, because that's pressure. You don't really do it, but let it just run out. So if you get something in your eye, and I've actually used that before when I had something in my eye, I couldn't figure out how to get it out. Just let the kind of drain it. Trying to think of what else. So I'm carrying Band-Aids, Neosporin. I carry sunblock. I carry a bright fluorescent vest, which you can buy at Home Depot, or I ordered mine online for like $5, and they're those things you see the guys work on the side of the road carry, right? And we have one in every one of our cars. Matter of fact, it's in the little slot you have in your door, your passenger. You just stick it in there, because if I have to get out on the side of the road, to change a tire or to render first aid to somebody else, I'm putting that thing on.
Yeah.
I mean, we don't get out of the ambulance on the side of the road without wearing a vest. And the things don't cost hardly anything. I mean, they cost $5. There's not a reason not to have one of those in your car, just in case you have to do a spare tire.
That's a really good one. I've actually never stopped to think about that. I have one in my truck, but I have it because there's one in my cert bag, which is in my truck, and I've never stopped to think about it as a suggestion for people, or even to put one in my girlfriend's car, which I'll be doing after this show. Not immediately after, but pretty quick after the show.
I don't know why I guess it was the first time I was on the ambulance, and they're like, you're the student, okay? If we have to go somewhere, your vest is over there. And you have to have that vest on before you get out of this ambulance if we're on the side of the road. I'm like, wow, so that's like a safety thing. Well, should I be doing that all the time? And it's like, well, actually, yeah, that kind of makes sense. And so I went to look, and you can buy the ones we have in the ambulance, I'm sure cost ridiculous money. But you can buy, a decent one that's like the guys wear on the side of the road, who are doing road construction or picking up trash or whatever. And it just makes you visible at night.
Yeah.
I mean, if you have to change a tire, why not?
Yeah.
Yeah, I just did a quick search online, and I mean, they're between $1 and $4.
Yeah.
Yeah, that's, the ones on your ambulance are probably a whopping $10, because, they're fancy.
And they have the name of the organization on the back. They say EMS. So I know that ones that have stuff on the back cost more, but you can expect that. But you don't have to spend that much. And it's so cheap that I, in fact, bought one for every one of our cars. And I have one in my first aid bag, just in case I didn't, grab it, or I have to send somebody else to get the bag or whatever. And then when they get there, I need it. Now, of course, I'm not sure what situation I was in where I was separated from my car and my bag, and now I suddenly need to be on the side of the road. I don't know. But you never know.
You never know. Anything can happen.
And
that would be pretty weird that you would be on the side of the road without your car or bag.
Yeah, but I guess I could be somewhere, see something happen on the road, say, you go do this, and I'm going to go over there. Another thing that's in there, I have baby wipes in my first aid bag.
Yeah, that's a good one. I have that in mind too.
Just because you have to clean crap up.
Yeah.
Sometimes literally have to clean crap up. We talked about vomit. That's another thing you might have to clean up. Blood, of course.
And then you've got peroxide.
Yeah, no, not so much. Not so much.
Blood cleanup, right?
Well, just to reiterate from the medical myths show, which we already did, but to remind people,
the only use for hydrogen peroxide in a first aid setting is to clean the blood off your clothes.
Yep.
Hydrogen peroxide does that incredibly well. Matter of fact, I had a clinical today, and I got blood on my leg, and it wasn't like all cool trauma blood. It was Ron doing an IV and not occluding well blood. And I took my scrub pants home, and I just took the hydrogen peroxide and poured it on there. And it's interesting because my scrub pants are dark blue, so you couldn't really see where the blood was. But if you just pour hydrogen peroxide on the cloth, wherever it hits the blood, it foams up, and you can see exactly where the blood was. And the reason it's foaming up is because it's reacting with the clotting agents in that blood and breaking up those clots, which is why you don't want to pour it on an open wound, because you want an open wound to clot. And so if you pour it in a wound, you're just stopping the clotting mechanism, and that's why you don't use hydrogen peroxide.
Now, if it's all you have to flush a wound out,
well, why are you flushing? I guess that's the question. I mean, did they like have a wound and they fell down in a bunch of cow manure? Well, then yeah, you're probably better off doing hydrogen peroxide or something, but and you don't have water.
Yeah.
Which would work just as well to flush things out and would be the agent of choice.
I'm just bringing it up before somebody says, well,
what will kill you the fastest?
Yeah,
having manure in an open wound won't kill you fast.
Yeah.
But it could have long-term negative impact as far as infection goes. So it might be worth it then. But, it depends, too, how quickly are you going to get them to definitive care.
Right.
Or how quickly are you going to get them to some water so you can just use it. I mean, I was actually looking for, to use it to clean. Like, if you have bleeding and you stop it, you have blood, run down your arm or whatever, and you can use hydrogen peroxide to clean that blood off. But it's for cleaning out blood. It's not for cleaning out wounds.
Okay.
If you have dirt and debris in there and you're taking them to a hospital, you're calling an ambulance, you probably don't have to even clean that up. And you're in a first aid situation, you're probably better just to place a dressing on there and stop the bleeding, because that's more important than it is to have the wound spotless.
Okay.
Because they're going to cut. You're going to get the ER. They're going to cut your dressing off.
Yeah.
Because they want to see the wound. Doesn't matter what you tell them the wound looked like. They're going to cut that off. They're going to take the thing off. They're going to try. If it's stuck, then they may have to do some more stuff to take it off.
And they're probably going to give you
they're going to give you
they're
going to give you a tetanus shot and antibiotics and all that kind of crap too. And if it is dirty, they will take it off and they will clean it, and they will clean it in the hospital with septic solutions and with water and basically soap. To clean stuff up, and then they'll give you antibiotics and stuff like that to keep you from getting an infection. So you don't really need to use hydrogen peroxide, even in that situation. Well, in a very strange situation where hydrogen peroxide was there and water was not. Maybe you should apply some electricity to it and turn it back into water.
There you go. What are some other random things that we should keep in our first aid kits?
I should have brought it in. It's in my car. I should have thought about that and brought it up here. I forgot. I didn't know we were going to answer those questions. But I actually don't have a whole lot of stuff in my kit. Considering I even know how to do like advanced stuff, I don't have advanced stuff in my kit.
Well, it just doesn't sound like it takes. As long as you're well versed with CPR or even basic.
Your
CPR
most to use the Matrix. Your most common situations are going to be CPR, bleeding control, Heimlich maneuver. Cuts and bruises. The only other thing might be if you were a broken bone. A broken bone would, assuming you're not out in the wilderness, but even if you are out in the wilderness, okay, here's what we do for broken bones. We stabilize it in place. Okay, so if you have a bone, you break your ulna and your tibia, which are your two bones in your wrist, your forearm. You break that, your arm's just flopping around, right? We'll straighten it out, put a board underneath it, wrap it up, and take you to the hospital. If it's open, like you got bones sticking out, we call that an open fracture. They don't call it compound anymore. I don't know, because they like to change names.
They keep changing names on me.
They change names. It's like first, second, third degree burns. They actually call them partial thickness, full thickness, and superficial burns.
When did they change that on me?
I don't know. Recently, it was in my book, and it's like they understand what you're saying because they've been around. But in a way, that one makes more sense because it says what it is.
Okay, the new names for that.
Right, and open in a way says what it is. It's open because there's a bone sticking out of your skin. And like if you had like one of those bones was broken and it was sticking out, and the other one's not necessarily broken, but your arm's at like an angle, we're going to try and keep it at that angle. We don't want to go moving things around, because one thing we'll check is for a pulse distal, so past it. So if you have a broken femur, we're going to check down at your feet. If you have a broken wrist or a broken arm, we're gonna check the radial pulse. If there's no pulse, what we say is if you have no pulse, you get one pull, meaning you can apply traction to the bone and see if it gives you a pulse. The point there is not to set the bone, put it back where it is. The point is to find out where there's pressure on a blood vessel that's stopping blood from flowing and fixing that. That's what we care about, not whether or not your bone's straight. That's an orthopedic surgeon's job. We just we'll immobilize it in place. I mean, if it's going at a 90-degree angle, we'll put pillows underneath it and stuff around it and strap that in that 90-degree angle and take you to the hospital and let someone with an MD after their name straighten things out. Because we don't want to move things around. I mean, if you're working now, if you're getting blood flow to distance, then that's good. That's the whole point. But there isn't anything necessarily. I don't carry anything to do splinting. I guess I would, if I had to splint something, I would improvise with whatever was there. I do carry cravats, which are bandages. They're like big handkerchiefs looking things, and they're adaptable. That's all right. I carry cravats. I carry some gauze squares, like 2x2 and 4x4 gauze squares as well, and some tape.
Yeah, the Red Cross has a little kit for like $5. I think it's actually their training kit that's got a cravat and it's got gauze and it's got tape and gloves and a little breathing mask. It doesn't have the valve on it, but it's just like that kind of plastic shield.
Yeah, and that has some kind of valve on it. It's just not. It doesn't cover both, does it? Does it just cover their mouth? Because I used to carry something in my pocket.
It covers their nose, not their mouth. And it's got a little hole out for their mouth, and it's got a little picture of lips.
So you put your lips on those lips and blow.
Exactly. So I think it may even have little eyes drawn on it in case you were confused about which direction, I guess.
Simple instructions.
Try to put the eyes over the eyes. That would be bad.
Yeah.
So that's basically a basic kit.
So you mean we don't need suture kits and all this other stuff?
Do you know how to do a suture? You probably do, because you looked like surgical first aid when you were a kid.
Yeah, no, I actually do know how to do sutures, but no, I don't carry suture kits with me. I have suture kits in the house, but that's also because I know how to do sutures, and Jen knows how to do sutures and does do sutures on a somewhat regular basis since she's in or on her way to dental school, but works in the medical field. So. Yeah.
And they teach that to wilderness paramedics as well.
Yeah.
How to do sutures. But they don't teach it to regular paramedics, so I don't know how to do it. So I do not carry anything I don't know how to use.
And I think that's a pretty important thing to keep in mind, because I know, especially with new preppers, there's this tendency, I did it, Jonathan did it, you probably did it too, to go out and you're just like, oh yeah, what is it, the Seinfeld joke, a Johnson rod? Oh, I got to have a Johnson rod. Even though you have no idea what it is, what it goes to, or how to use it, you're like, oh, well, I got to have that because, when the world comes to an end.
Yeah, then I'll need this.
Yeah.
Even if I don't know how to use it.
And the only good explanation I've ever heard is kind of a military explanation of, I don't know how to use it, but somebody within my group or somebody within my immediate vicinity might know. But there's not going to be an instance in a day-to-day situation where you're going to need to suture something up. And there's a process that goes into suture. I mean, the wound does have to be clean, and it has to be a certain... If
you're going to seal it in there's a whole different rule.
Yeah, that's a whole other set of stuff.
But then not only do you need to carry sutures, you need to carry some sort of disinfecting, cleaning stuff to do that. That was one of the things that, like, early on when I was doing EMS and wanting to build a kit was don't carry anything I don't know how to use. And I think that's a good prepper philosophy anyway. There is some extent. I mean, if you're a Rawlsian prepper and you're going to, like, build your compound out in the woods, then maybe you're gonna stockpile stuff that you don't necessarily know how to use because you figure someone else will come along, or you can trade. That's a lot of things. People will be like, I'll just trade for it.
Yeah.
I'd rather carry ammo in my own caliber that I can trade for than, it'd be like buying ammo in a caliber of a gun you don't own.
Yeah.
And stockpiling that so that you can trade it.
Yeah.
Well, do you know that somebody else is out there with that caliber? I mean, I don't know.
Yeah.
Yep, and that's the whole idea. Worry about the things that are probably going to happen.
Yeah. I will say this, and it's more about skills than it is about gear. If you guys want to go further and learn more skills, or even do what I did, which was take EMT Basic and learn more skills, or take a wilderness first responder course and learn more skills. I remember reading 1 Second After. I was talking to some people about this the other night who had never heard of that book. But 1 Second After, it's an EMP attack, and it's a small town in North Carolina, and they're on a major highway. And they quickly realize that they need to stop people from coming into town. So they block off the exit ramps and don't let people come into town. Matter of fact, they kind of screen them and let them go on and tell them to go on. But one of the things they do when they screen them is they have a list of professions and skills that they need that they don't have.
Mm-hmm.
And I thought, well, if I walked up to that exit ramp, me and the family, and they said, okay, do you have any skills that we might need? I had nothing to say. Oh, yeah, I can program a computer. That's going to do me a lot of good after an EMP pulse, right? So they're going to be like, well, that's great that you're a computer programmer. What you need to do is keep moving right on down the road. But now if I come up and I say I'm a paramedic, they're like, oh, medical person. So you can, we'll bring you in and your family, because they wouldn't take anybody that would not bring their family.
There was like the...
They'd be like, okay, we need your skill. And if the guy's like, okay, see you later, honey.
Yeah.
Then they were like, we don't want that guy.
Yeah.
But they would be like, yeah, so you and your family can come in. And that was one of the things I realized, that from a survivalist point of view in those big situations, was it was good to have a set of medical skills. They don't care whether you have the gear. I mean, because they had a hospital.
Yeah.
And but they only had like one doc or two docs in their little town, and a nurse and a vet. Those were the guys doing surgery later on.
Yeah.
Because that's all they had.
And I guess the point to that is also, if you have the skill, you can improvise everything else within reason. I mean, drugs you can't improvise, but for the most part, when it comes to that kind of stuff, it's improvisation comes in.
Yeah. And then paramedics are the kings of that. We make do with what's there, That's actually something that kind of separates us from everybody else in the medical field, is that we don't work in the hospital. We're pre-hospital care. And so we have to deal with situations that other people don't know how to deal with, don't have to deal with, and kind of be on it right away. It was one of the complaints in cardiology. We took it with the nursing students, and at one point one of the nurses was like, you guys are just different when you approach a patient than we are. We're like, hi, how you doing? And you guys are like, bam, what's wrong with you? What do we need to do? Do this thing, do this thing, do this thing. And that's because that's the way we do it. And one of our instructors said that even in hospitals, they have what they call... She was like, well, if I'm in a hospital and someone goes into cardiac arrest, I'm going to hit the panic button and they're going to send a crash team. Well, she said, well, some hospitals are putting paramedics on the crash team. And not doctors, not nurses, just paramedics, because that's what paramedics do.
Yeah.
They come up on cardiac arrests, and they do cardiac arrests. Most of the time, if you have a cardiac arrest and you call an ambulance, those paramedics are going to work it on scene, and if they don't bring you back, they're not even going to transport you, because there's nothing they can't do in the field that they're going to be able to do in the hospital to bring you back from a cardiac arrest. So, yeah, that's the one thing about EMT and paramedic training, is it is kind of made for that out-of-the-hospital setting. So if you're looking to get serious skills as a prepper, going into EMS would give you that. And then we adapt. We adapt and overcome, which actually I think is the Marine Corps' motto, but
I think everybody uses it now.
And we just, we figure crap out when, when someone has... Well, like if you have a broken ankle, like down there at the ankle, the best way to splint that is to take a pillow, put it around it, and then wrap the pillow with a cravat or with tape or something to hold it in place, because it conforms to your limb and it holds it motionless, which is all that you really want. So.
Good to know. Well, awesome. Thank you, Ron. We really appreciate you coming back. I'm sure we'll have you on again someday in the near future. We always have a good time and joke around together and get some great information out there.
And you get sexy CPR and sexy abdominal press.
Oh, man. That's the
best part.
That is the best time. And actually, it's hard for us to see each other, I think, even to this day, without mentioning at some point in our conversations sexy CPR.
Yeah, that's just something that comes up all the
it's
time.
just kind of, like it's become one of those inside jokes. All right, well, thanks again. And you are, again, Ron Davis from EMS Newbie Podcast, and the address is...
It's Confessions of an EMS Newbie, and it's emsnewbie.com. That's NEWBIE for newbie.com.
Awesome. Thanks, Ron. That we wrap up episode 34. Thank you for joining us. Help support In the Rabbit Hole Urban Survival podcast and blog. We're now accepting applications for show sponsors. For more information, please use the contact form on the site and choose option Advertise. If you like the podcast, make sure to leave us a review in iTunes. It helps others find us. If you didn't, well, why not tell us about it using the contact form on the site? Seriously, the show is for you, the listener. Be sure to connect with us through Facebook, Twitter, YouTube, and the Urban Survival Forum through the links on the top right-hand side of the site at www.intherabbithole.com and on the forum, forum.intherabbithole.com. Also, don't forget to sign up for the newsletter. By connecting with us, you receive updates about the site and notifications of new articles and podcast episodes. That's right, we're not just a podcast. Every week, articles are posted to the site, intherabbithole.com, that cover all manner of topics relating to surviving in an urban environment, whether in good times or in extreme circumstances. Show notes are posted with each episode where we invite you to comment on the show and interact with us. From Houston, Texas, till next time, stay safe and sound.